In this module, you will learn how to document home medications on a patient's record, modify those home medications as required, reconcile their home medications to an inpatient drug chart, and prescribe additional inpatient medications. To add a patient's home medications, click Home Medications in the Workflow menu. You will see that the meds history has a blue exclamation mark which shows that it has not yet been completed. Click on it, click Add, and search for the medications that you wish to add. Select the correct order sentence, click OK, and add any subsequent medications, repeating until all home medication has been entered. Select Document History. The meds history will remain as a blue exclamation mark until pharmacy have reviewed the history inputted. Once the pharmacy review is complete, the meds history link will show a green tick. If amendments are made by pharmacy, you will be informed. To make changes to patients' home medications, click the meds history link, right-click on the medication you wish to amend, select Modify, make any changes as needed. Here we are changing the dose of the ibuprofen from 400 mg to 200 mg. Click Document History, and the medication history has been modified. You can use the same process to renew, cancel and discontinue, or complete the medication in the same way. If you select Void, it will remove this home medication. In the home medication section of the workflow, click on the admission link. This will take you to the reconciliation page. Here you can choose which drugs you wish to continue and which ones you don't want to be prescribed as an inpatient. The green triangle indicates those that you wish to be continued during the patient's hospital stay, and the red square indicates those that you do not wish to be prescribed as an inpatient. Here we are selecting to continue the patient's home medications. This has moved both the drugs onto the right-hand side. The blue cross indicates that there is missing information, which needs to be completed. One of these mandatory fields is Give Additional Dose Now. A clinical judgment needs to be made whether it is appropriate for the patient to receive the dose straight away or wait until it is next due in the usual schedule. You would do this for all medications that you wish to prescribe. At this point, you can prescribe new medications for the patient to start as part of their admission. To do so, you would click the blue plus sign at the top, search for the medication you wish to prescribe, and fill in the details required. Here we have selected bisoprolol, and we are going to choose to give an additional dose now. Click Sign. Both the home medications and the newly prescribed medication can now be viewed on the drug chart. You will see that as we have selected Yes to give additional dose now for the bisoprolol, that a STAT status is showing next to this drug on the drug chart, indicating that it must be administered as soon as possible. To prescribe a new medication for an inpatient, select New Order Entry in the Workflow menu. Type the medication you wish to prescribe in the search bar. Here we are searching for amoxicillin. Select the most appropriate order sentence and click on the envelope which indicates the orders for signature. Click Sign. Click on the blue cross to fill in any missing information. Here we are completing the diagnostic certainty, indication, and we are choosing to give an additional dose now. We've also set the duration. Click Sign. When you open the patient's drug chart from the blue menu, refresh the record and you will see the newly prescribed medication on the drug chart, again showing as stat as we selected yes to give additional dose now.